Hi, good morning, Tinkesh.
Good morning, sir.
I'm Dr. Kiran here.
I'm Tinkesh Kausik, fitness and nutrition consultant. Today we will talk about some new topics which will help you in your general life. So, what is the today topic, sir?
See, I wanted to talk on the value of foot,
Yes, value of human body.
value of human body.
Yes,
See, I being the doctor treating diabetes patients, sometimes, yeah, it's rarely nowadays, but still it do happen. People, after they diagnose that they have their diabetes, and few of them may have very high blood sugar levels.
okay,
So high blood sugar levels means like 300 milligrams, 400, sometimes even 500, and their HbA1c like above 9 percentage, 10, 11 or even 12 or even above. The normal HbA1c is below 7 percentage,
okay,
and the blood glucose levels normally is fasting below 100 milligrams and postprandial 140 milligrams. So when blood sugar is normal, the blood is like water flowing.
right,
But when blood glucose increases, the viscosity of the blood increases. So it becomes thicker.
thicker.
So blood can't flow freely.
Yes,
So heart has to pump it with great effort,
true.
meaning that the heart will get tired, meaning that the blood pressure may rise, meaning that the heart left ventricular may get thickened, things like that.
Okay,
In the similar way, kidneys have to filter the blood, right?
yes,
So when the blood is like clean and free like water, it's easy for the kidneys to filter it.
true.
But if the blood glucose is high, or if the blood cholesterol is high, or when the blood is having impurities, let us discuss in this way. So it's difficult for the kidneys to filter the same blood, right? But
Right.
it does the job. Next comes, the blood has to flow from the heart all over the body and comes back.
Yes,
First of all, sedentary lifestyle itself, it's very difficult for the blood to come down and come back, come down and come back. So heart has to do a lot of job to pump the blood down
down,
and get it back.
to up.
Yes. And despite this, you now have high blood glucose levels for a long duration, not a day, 2 or 3, for a
Yes, long duration.
long duration. What happens? The blood flow to the toes, feet may get affected.
Okay,
And anybody have a small injury? See, it usually heals for majority of the people,
people.
but sometimes for someone that may not heal. And in diabetes patients, there might be neuropathy where they can't sense the pain,
Okay,
they can't appreciate the pain. See, if something pricks, we understand,
yes,
but they might not be able to recognize that. So there may be a wound, and until it gets badly infected, until it get infected and then some bad smell comes, only then people around him may recognize it. So by then it will be too late. So what happens when the flesh is all, you know, very highly infected and blood flow is not there properly, and we doctors, when we feel that we can't save the foot, and the good for the patient is that we remove whatever is very badly affected and there is no chances of, you know, recovery for it, then we have to remove it.
yes,
See,
true.
that's called amputation.
Amputation.
So gangrene, that condition may be named as a gangrene. Let's not go details into what kind of a gangrene and stuff and all that. So gangrene, that means the doctor might have to remove that particular part. Sometimes it happens only for the toes,
Toes.
it may happen for the foot,
Foot.
it may happen for the below knee,
Knee.
it may happen for above the knee. So you know all this, because you have practical experience. Though your condition is not so, some viewers may think that I am putting it to
No,
this
no.
way. No, yours is electrocuted. It's a different situation. But the point is that what is to lose a foot?
Yes,
What are the sufferings? And since you experience this pain day in and out, though you are a very strong person, you live your life, you are fighting for your life, but definitely what is it to miss, our body essential parts and living with it? I thought we would discuss about this point.
Yes.
Sorry, I made it very elaborated, but for some viewers, I thought I would better put it in these words.
Yeah. As per my point of view, if diabetes is the cause of amputation, then it will lead you to mental trauma first thing, because you won't accept it that why it happened to me, something I did wrong in my life, and it will also cause you emotional trauma, and physical trauma is already there because you are going for amputation in a few months as per your decision. It will cause you bedridden for few months after amputation. It will cause you bedridden also for earlier months also, because you will be on bed, you cannot move freely like earlier. And after amputation, when you go for prosthetic limbs for first time in your life after a few months, then there is a procedure for that. You need to follow that. They will take your cast as per your stump size, as per your amputation. They will P&O will guide you which prosthetic foot will be good for you, and nothing can replace a natural body, natural
Exactly.
foot, right? So there will be so many limitation in your upcoming life if you won't accept it in a right way. It will lead you to limited mobility even after getting prosthetic, right? I know so many people. I deal with their physical strength, their mental strength, their emotional trauma. So it will cause you financially drain. It will drain you financially. It will drain you mentally also. Then let me tell you, if you are below knee amputee or you lose your foot due to gangrene, or then basic foot cost start around 40 to 50,000, and as much as you put money, you will get that uh, benefit of another foot. Like, it can be anything amount, starting from 50,000 to 10 lakh. We can go anywhere, and limited mobility that time there will be also, because every foot has their specification. For walking there is different, for running there is different, for swimming there is different foot. So it will drain you completely financially, and every 5 to 6 year you need to replace that also. You want to upgrade, there will be a maintenance charges also, so many things. So you need to take care of your health first thing. Don't avoid it in any situation, please.
Yeah, well said, Tinkesh. See, the pain, the emotional pain, the financial loss, it is definitely, beyond one's imagination.
Yeah.
But as a doctor, when I say, see, you need to control your blood glucose levels, and sometimes, when sugar is very high, we doctors have to give insulin.
Yes.
But unfortunately, there is a myth in the society about insulin, saying that once you start insulin, it is a lifelong. Taking insulin is very painful, and we have to counsel a lot to explain to the patients that truly today insulin is not painful.
No.
It is very, very easy to take. They're pen devices, very small needles, and very many ways of monitoring the sugars. When we talk about insulin, patient might be afraid that he may get low sugar. So there are many ways, to not to have low sugar, and in case still if there is a low sugar, what to do, immediate measures so that you come out of the low sugar. So blood glucose anything less than 72 milligrams may be called as a low sugar. And then there are insulin means it is not one insulin. There are many types of insulin.
Okay.
So when the sugar is very high, we give this kind of a good insulin that brings down the sugar. When the sugar is kind of close to near normal levels, then we may use another insulin that will maintain the glucose and not bring it down further. And sometimes people may not be able to take it 2 times or 3 times daily. At that time, we may choose a different one which is once daily.
Okay.
If once daily is not giving very perfect control, then we might choose another insulin. So there are many different insulin nowadays. So very important is insulin is not necessary for everyone.
Yes.
I am talking about if it is necessary for someone, they should be able to take it. They should consider it. They should talk to their doctor, get all their doubts cleared,
Yes.
and make it possible. Ultimately, controlling diabetes is preventing the complications.
Yes.
In fact, managing diabetes is nothing but saving your heart, saving your kidneys, saving your eyes, legs, everything. Because the blood is everywhere in our body, and if glucose is high in that blood, it is everywhere high.
Yes. Entire body.
Entire body. So it is very important, friends, if someone is a diabetic, please keep the blood glucose levels in good control. Talk to your doctor,
Yeah.
get all your doubts cleared, and be in the safe zone of control. If someone is a pre-diabetic, where they are not a fully diabetic, where they need medications, they are a pre-diabetic. That means if this particular gentleman takes precautions, he may stay in the pre-diabetic range, or he may even come back to a non-diabetic range. But majority what we are witnessing, the pre-diabetic person becomes a diabetic person.
Okay.
So diabetic person becomes a complicated diabetic person.
So they,
So when you are with the doctor with high blood glucose levels, it's for the doctor to give you the medications, and obviously you will have to follow good diet and exercise. But when somebody is in a pre-diabetic condition, here you may not need a doctor's medications. What you need is only your willpower, a good nutrition advice, maybe a doctor consultation for proper guidance.
yes.
So from the pre-diabetic range, you come to a non-diabetic range.
Non-diabetic.
So when you are in a non-diabetic range, you are completely comfortable and you don't have any diagnosis of diabetes, right?
Right,
So
sir.
you don't have any hashtags of diabetes here.
Yes.
So you are comfortable. So usually nowadays when we talk about pre-diabetics, it is majority of the people who are little obese.
Yes.
So people should be able to reduce that excess weight, and that itself will help to
Bring your diabetic within range.
within the ranges. So it is a very good way. So diet really helps in preventing diabetes for normal people.
Yeah.
If somebody is in a pre-diabetic range, they better avoid all kinds of high carb or high glucose foods and stay in the safe zone. If still someone is crossed the pre-diabetic range and is in a diabetic range, there are wonderful medicines. People are all afraid of side effects, and there are some videos in YouTube quoting about the side effect of the medicines. So when somebody reads about the side effect of the medicines, nobody wants to take the medications. See, side effects are something like undesired effects. We treating doctors, we hardly see somebody having such kind of a side effects. Very hardly and very rarely we come across. And even if somebody experiences any undesired effects, there is a specific reason why it happened so for that particular person. So when it is given by a professional, we take precautions and see that they don't get such undesired effects and get the desired effects. So don't worry about side effects, my friends. You have good doctors near your home, they will definitely help you for the best. And when we spoke about amputation, it's very expensive.
Yes, it's very expensive for your rest of your life.
Yes, you spoke about certain aspects, right? But let me tell you, if a person is hospitalized, from the day of hospitalization,
To get discharged.
no, here we are talking about a gangrene foot.
Okay.
The time it is understood that this foot is very bad and it has to be amputated, before even the amputation decision is made, there are efforts made to save the foot.
Right.
That itself is a huge expenditure.
Yeah.
Somewhere people lose around 50,000 to 5 lakh rupees just to come to a conclusion, this this foot is no good to save. And if you don't amputate the foot, it is going to cause deep troubles elsewhere in the body.
Correct.
That itself is that amount. and then the decision is made for amputation. Now, from the decision making until the foot amputation or toe amputation or whatever below knee amputation is done, that is a completely different cost.
Yeah.
Agree?
It's like pre and during and post.
Yes. And once the foot is, whatever the part is amputated, from that to complete healing is again a different cost.
Yes, true, sir.
And how much of family trauma it is to help this person. And from that position, from complete healing of the amputated part, and then comes whatever you said, prosthetic, training, how
so
to
many
come back to the normal life, all these things. And again here, in a diabetic person, that blood glucose level should be in strict control, because it is not an accident where it happened to one foot or a toe.
Yes.
It is a complete systematic general thing. So there can be every chance of the similar situation happening to the other leg, the next foot or other toe.
So it will be with you for your rest of your life.
Exactly. So my friends, please do not ignore diabetes or hypertension or any lifestyle diseases which are highly modifiable and greatly, managed and best treated with your doctor. So I wanted to definitely take advantage of Tinkesh to mention this, situation. I had been into diabetes treating for more than 20 years now, and I have seen such situations in my own family, not far off.
Oh.
In my family, I have seen whatever I just now mentioned. And very recently, my daughter's, tutor, father had a similar situation, and the ma'am was talking to me. She was discussing to me about all the aspects, and the decision to say yes to the doctors for amputation was very traumatic for her. So I had to help her in making her decision, though I was not the doctor at that treating, because they were in a different city.
Yes.
But I had to make the ma'am understand, see ma'am, you have to accept this and let that go. If you don't let that bad foot go, it is a threat to their life.
True,
So
sir.
to save the life, the doctors are trying to do so. So please go forward and do that. That was my decision, and she was very happy that I could help her in making the decision and so forth on.
Yeah. So I also met many amputees who lost their limbs due to diabetes only. So they got small injury, then it didn't recover for years, then it turns into gangrene, and that causes amputation. It can be below knee or above knee, and that's not stopping for diabetes. I also meet 3 or 4 people who lost their other leg also due to same condition.
Same condition. Also, at this situation, I also want to mention amputation's next cause is also accidents.
Yes, yes.
So, please, friends, especially bike riders, be careful. Our legs are very precious. We don't value what we have until we lose it.
Until we lose it.
Please, I take this opportunity once again. Please be responsible.
For your life and people around you.
People around you. It's very important. I had a professor when I was in Europe. He is a very elderly professor. He was by then above 70s in 1995 or 1997, I believe. So he used to tell in those days the amputations they did during the Second World War. He used to mention how they used to do the amputations because of the bullet injury. And those days, to stop the blood loss, amputation was the only way to save the life.
To save life.
So amputations were done, the professor was feeling so sad about mentioning that. See, what he was again mentioning was, he's able to recall those days Now when he is doing the amputation for diabetic patients,
Yes.
so after the Second World War, the highest number of amputations he mentioned he was doing, it was for the diabetic patients. So he said to me, before 2000 about it. Now we are in 2023.
23.
Almost 23 years have passed, but still I remember his golden words. My students, never ignore your diabetic patients. Counsel them from the day one. They might not understand what you are mentioning them in the beginning days of their diabetes when it is diagnosed, but as diabetes progresses and if it is left uncontrolled, it surely may lead to unwanted complications like retinopathy, nephropathy, neuropathy, cardiomyopathy, peripheral vascular diseases. When we talk about peripheral vascular diseases, it comes to the foot and other distal parts. So Tinkesh, thanks for sharing this
My pleasure, sir.
time. When people like you mention, it definitely inspires and motivates the people, the healthy people, to take care of themselves. They have to take care of their mind, not become stressful.
Yes.
They have to take care of their body, and they also have to take care of their other medical conditions in case if they are having it.
Yes.
So please keep all these conditions in good control and stay in good health. May God bless you. Wishing you all a good health.
Thank you.
Signing off, Dr. Kiran and Tinkesh.